Oh, and I'm interested in how cities impact health in general.
Hi, my name is Adam D'Amico. I am a second-year FE-Biostat student at UC Berkeley. There we go. I am originally from Rhode Island, and I came out here for my MPH degree. My research interests include behavioral risk factors among men who have sex with men in San Francisco.
Hi everyone, I'm Addison. I'm currently a dietetic intern at Napa State Hospital, so I'm working to get my registered dietitian's license. I was at Davis for the MPH program last year with kind of an emphasis in nutrition. The year prior, I got my master's in nutritional biology from Davis. So I'm really interested in nutrition and kind of prevention and really kind of working more in a public health context as opposed to one-on-one with individuals. I'm really interested more in policy work because we have such toxic food environments. So that's kind of what I would like to work on.
Hello, my name is Gloria Kahamba, and I'm a master's student in public health at UC Berkeley, and my focus is on infectious diseases and vaccinology. And I'm originally from Tanzania, that's in East Africa, and I came in the US about 6 years ago to do my college education, and that was at College of the Atlantic in Maine, where I did Bachelor of Arts in Human Ecology with a focus on pre-medical and health sciences. And here at UC Berkeley, and I'm mostly interested in the epidemiology, impact, and control of infectious diseases in sub-Saharan Africa.
Hi guys, my name's Cathina. I'm a second year master's in public health student at UC Davis. My emphasis is mainly on maternal and child health, especially child's health and autism spectrum disorder. I'm currently doing my thesis at the MIND Institute, which stands for the Medical Investigation of Neurodevelopmental Disorders. I'm originally from Virginia, moved here last year, and I did my undergraduate work at Pittsburgh in psychology and philosophy of medicine.
Hello, my name is Lila, Sheira. I am a second-year maternal and child health graduate student in the Master of Public Health program at UC Berkeley. I am originally from Egypt. I moved to the United States when I was young. I grew up in the Southeast in between Georgia and South Carolina. I did my undergraduate degree at the University of South Carolina, the real USC. And I, after getting my degree, I joined the Peace Corps, and I lived in Latin America. I lived in Ecuador for 4 years total, 3 years of that with the Peace Corps. After that, I came to Berkeley, so out on the West Coast for the first time. My research interests are reproductive health outcomes, family planning, and contraceptive access internationally.
Hello, my name is Dan Wu. I am also a MPH student, just finished out the program here at UC Davis this past September. Currently I'm working part-time as a research associate with the Public Health Institute, working on their climate change and health project, trying to integrate climate change into the clinical setting and seeing if that's feasible to do. My undergraduate degree was in design and also environmental planning, and so my background is kind of tending towards environmental health. And so I worked for a number of years for a local civil engineering firm before going into the MPH program at Davis. So ultimately I hope to focus on climate change and health, and also focus on promoting not only public health, but also just ecological health at the same time.
Okay, thank you. So our first question is, can you tell us a little about the MPH concentrations you are pursuing?
So at the UC Davis, there are two main concentrations. It's either general track and epidemiology track. I'm part of the general track, but what really makes your concentration is what kind of project you decide to pursue. And I guess my project was mainly just on children's health, which is what I was interested in. The great thing about the general track at UC Davis is that you can explore a lot of courses. They don't give you a set number of classes you have to fulfill. It's basically whatever you have interest in, and you build upon that.
I can talk a little bit about my concentration and just briefly kind of juxtapose the Berkeley Public Health program. It's a little bit different. And I'm like, oh, UC Davis. It's like really cool to hear other options. So good thing you guys are here hearing from different schools. Our program has several different concentrations. Mine is health and social behavior. Adams is epidemiology and biostats, for example. And so you apply specifically focusing on one of those concentrations, and you tailor your application to explain why you're interested in that specific area of study. So my focus, health and social behavior, is actually considered one of the most general concentrations that Berkeley offers. And you can really shape it however you would like it to be, but it really focuses on this ecological understanding of health and thinking about behavior, but even beyond behavior, thinking about how the environment really shapes the options for our healthy choices that we have. And I, in particular, am really interested in thinking about, from a social justice lens, how social justice should be really driven by making sure that people have the opportunity to lead healthy lives. And so that's kind of the lens that I approach my degree in. And for example, I'm interested in incarceration, so there's opportunities to think in and look at that. I'm interested in education, and I'm also interested in housing. So I bring those healthy housing and the school to prison pipeline and thinking about how that really impacts health outcomes.
I could speak for a moment about epidemiology and biostatistics. So epidemiology, for those who don't know, is sort of like the bedrock science of public health. So it's the study of diseases and their determinants in the population. So an epibiostats concentrator focuses on learning all the different study designs that public health professionals use in order to study different diseases depending on what kind of data is available and who you have access to. And biostatistics is the application of statistics to these problems, so learning all of the methods for analyzing the data we have and what kind of questions we can ask and what kind of questions we can answer definitively or with some degree of certainty. So I really think about it as sort of trying to add to the foundational knowledge of what causes disease and who has disease.
And if I could piggyback off of Adam's epidemiology biostatistics explanation, the maternal and child health concentration at UC Berkeley is pretty specific. While there's a big difference between people who want to study children and women in pregnancy and reproductive health outcomes, we all are within the same maternal and child health concentration, but similarly to epibiostats, as we say, our program is highly quantitative, and we look, pretty much the only difference between the epibiostats and MCH program at UC Berkeley is the fact that we have our thematic area. We're very focused on maternal and child health issues, but it's very quantitative. We want to look into research designs and how can we quantitatively as well as qualitatively assess the impact of a program or the study design to best get an outcome that a desired outcome.
I can speak for the infectious diseases. So infectious disease is the most science-focused, I guess, of most of the concentrations at UC Berkeley. And we study different kinds of pathogens that cause infectious diseases worldwide. And we just try to understand, why they cause the diseases that they cause or why they affect this population more than the other population. And also the diseases that, the infectious diseases that we study, we try to understand the epidemiology and how they get transmitted from person to person, and some of the methods that we can use to control those infectious diseases.
Does anyone else have anything to say?
Maybe I'll just add a little more about the Davis's general track. Again, like the kind of benefit of the general track versus the epi track at Davis is that there's a lot of flexibility, and kind of Cathina touched upon that you can tap into a lot of resources at UC Davis through, the School of Nursing, School of Medicine, School of Education, School of Law. So there are like kind of partnerships and opportunities that you can explore through that flexibility. And so like for my specific project, I was able to meet, somebody in the field working on climate change and health, and so kind of talk to them about my interests, and then brought my proposal to the program director and said, will this, kind of fit within the program requirements? And so you can kind of tailor your projects like that. And so you can look at the general track as potentially like a limiting thing, because it doesn't give you necessarily like a specific focus area or expertise. But then at that same time, I kind of tend to look at it as like this gives you an opportunity to really kind of explore what you're interested in and broaden out, what defines public health, because it's such a big field of study.
I will add, for the UC Davis generalist track, you can also make it more specific too. My focus was more in nutrition and how it relates to public health. So I did an internship at the California Department of Public Health in the Chronic Disease Control Branch, and use that to kind of tailor my experience in the program towards nutrition. So you can kind of take it either way. I think it's great that you can kind of kind of dabble in a lot of different things if you're unsure of what you're interested in, because there's a lot of things in public health that people aren't always aware of, and then you hear these great seminars where people come from different areas and you never thought you would be interested in something like that, but something sparks your interest. So it's really nice to have that flexibility to either be kind of more general or also tailor to your own needs for whatever your interests are.
Thank you, Addison. Well, the next question is, what was the #1 thing you wanted to know when you were a pre-public health student?
A pre-public health student, like in a, are you referring to like undergraduate work?
Yeah, undergraduate. So
Okay.
before you came into public health.
So I actually didn't do pre-public health as my undergraduate degree. I got my BS in biology and my BA in economics. And I worked for 2 years after undergrad. And slowly I knew I was really interested. I knew I'd always been interested in medicine, and I didn't really know what that kind of looked like for me. I thought, maybe I could go and be a doctor, but kind of slowly realized that I was really more into prevention. And specifically, as I kind of accumulated various volunteer activities, I realized that I was more interested in the population, and not one-on-one counseling is great, but I really wanted to impact a larger number of people. So I kind of took a circuitous route to my public health major. I think you don't always have to, I didn't really know that there was, I went to UC Santa Cruz, there was no pre-public health major. So, I don't think you have to start out with that and be interested in public health. You can take lots of different routes to get here.
Does anyone else want to answer the question?
I guess I'll chip in again. So for me, it was actually like, what is public health? And it didn't take me until further down the road to even find out there is this field of public health. And then when I read more into it, right, like the study of how do you address the population as your quote unquote patient, looking at preventative approaches to promoting health and things like that. And then the more I learned about it, the more I saw just how multifaceted and interdisciplinary public health can be. And you have, so many of us focusing on different aspects of it, but we're all practicing, looking to go into the field of public health. And so I think I kind of wish I had known about what public health was just sooner. And at Davis, the program is still relatively young compared to a lot of other schools of public health and programs out there. And so I think that played into my not hearing about it sooner. But again, just reaching out and researching and understanding what public health is, that was something that I think would have been great, had I found out about it sooner when I was like an undergrad. So.
I second that. That's exactly what I would say. And I'm still sort of, that led into like, well, what is it? But also what like roles can I play? Like what can my profession look like? And I think that because it is so multifaceted and interdisciplinary, I'm still figuring out what that looks like. So that's like a question that I had. I'm getting more information, but at the same time, it's just leaving me with like kind of more questions about how health plays a role in all kinds of different aspects of pretty much any sector that you think about. Business, like thinking about like health in the office and how you can implement organizational policies that like promote health. And how some policies like don't promote health, and how some working spaces are actually, breaking the law in terms of thinking about worker health. So like that's sort of like the business, and obviously in the government aspect, just thinking about how the government should be taking responsibility for the health of the population that it serves. So as I keep going on, I keep finding out more ways in which I can utilize my degree, and still trying to figure out, well, what does that look like specifically for me?
Thank you, Victoria. So our next question is, how did you choose which MPH schools and/or programs to apply to?
Well, I think for me, the first thing I did was try to figure out what I want to do in public health. As everybody has said, it's a very big field, and you kind of have to figure out at least or know what you want to do. So I knew that I was interested in infectious diseases, and I also did an internship in undergrad at the Ministry of Health in Tanzania, and I worked in the epidemiology unit, and I really liked what they did. So data collection and just how to use data in studying different health problems and knowing how diseases are transmitted. So I was interested in epidemiology and infectious diseases. So I started looking at programs which are like epi of infectious disease, or epidemiology alone, or infectious disease alone. And there aren't so many schools that offered infectious diseases. Berkeley was just one of the few, but a lot of schools offer epi. So I checked into a lot of different schools, and so that was definitely one of the things, just knowing what you want to do, that really helps into figuring out which school offers that program. And then after that, I just also try to see which one is more attractive, diversity-wise. I'm an international student, so I would want to go to a place which really, attracts international students, and they offer support to international students, so, including funding. So that was also definitely something I was considering when I was applying. And also the schools, when you do your GRE and you know what your GPA is, you know what your experience is. So you also try to figure out which schools are going to accept you. And of course, not all the time that if you have a low GRE that you're not going to be accepted by a certain school. Different schools have different requirements, but I think it really helps knowing, where you're applying and what they require. So that's really good.
Thank you, Gloria.
Something else I was going to add, I went to at USC, it's a pretty large school, South Carolina, and so I was really interested in going to a graduate school that had smaller programs. And so while Berkeley is a huge school, what really attracted me and kind of sealed the deal with Berkeley is when I found out that the maternal and child health cohort is generally 10 to 15 students. And this year, there's 8 of us in my cohort. So when I need to get in touch with my professors, I have no problem whatsoever. I can get in that day or the next day. And that was really important to me after my experience at USC, where it was harder to get in touch with your professors, and there was a line of students at the door trying to get in with them too. I was also interested in the Bay Area. I'd never lived on the West Coast before, and I knew that there was a lot of work being done regarding social justice, immigrant health, and those were things that I was really attracted to. And then, of course, I was really attracted to the reputation that Berkeley has, to to be completely honest, it's something that matters when you get your degree, and when you put forth your best at Berkeley or at any school that you go to, your efforts aren't only for you, but for the people who come after you. And the people who were there before you, their efforts are for you too. So you want to uphold the reputation. And so that's something that hopefully when I go look for jobs, it will help me.
I'll say one quick thing about why I chose Epi-Biostat. So I knew that I was interested in quantitative research, sort of generally. I just sort of liked the dorkier side of things. So I was gravitating toward that, but I wasn't exactly sure what I wanted to research. Public health or disease generally. So concentrating in epidemiology, biostatistics made a lot of sense to me because it's sort of like getting a whole toolkit of methods that you can apply in all sorts of different situations. So I have classmates that are doing research in social epidemiology, so things like social determinants of health. I have friends who work in infectious disease. I have friends who are interested in environmental health. So there's a whole range of research areas you can go into with a degree in epidemiology and biostatistics. So that's what brought me to that.
And I had another thing that I looked at when I was applying to schools is location. It's definitely important because ideally after you're done with your graduate degree, you're going to go find a job. And finding a job is hard enough, but it will make it easier if you guys have the right connections, being able to meet the people or being able to do internships after classes. And one of the great things about UC Davis is that we're only half an hour away from Sacramento, which is the capital, and it houses the California Department of Public Health. And I had a lot of friends who did work there, their thesis projects there, and are hoping to get a job there as well. And one of the main reasons I came to UC Davis is because I came knowing that I wanted to work with kids with autism and their families and being able to overcome barriers for them to get the services they need. And the Mind Institute at the medical center has that. And I was very much looking at that when I was applying.
I think for me, I was kind of in a good spot. I was already here in grad school, so it was an easy transition. One of the members of my cohort from the nutritional biology program had just done the MPH program here, so that's how I heard about it. And it was a great experience, like Cathina said. Being so close to Sacramento is amazing. You have so many opportunities with the Department of Public Health, the Department of Healthcare Services, UCDMC, so the medical center. There are lots of different things available to you, as well as, if you're interested in going other places, if you're looking at working at counties, at various clinics that are, there's a lot, I think there's 7 free clinics that are based around through UC Davis campus, but also through their med center. So there's lots of different opportunities due to Davis's location. So I think that was also a really, not only was I here, but it also offered a lot of opportunities.
And I'll just add in a little bit about my method for picking my school and concentration. I interviewed current students at the schools that I had kind of narrowed it down to that I was interested in, and asked them, because as I mentioned earlier, really understanding what the field of public health can include and does include was at the time something I was still trying to figure out, especially because I hadn't really studied it at all yet. And so by picking out ones, so health and social behavior talked a lot about social determinants of health, and that really resonated with me. And so, but there was a few other ones that I wasn't sure, well, maybe this fits too. And so by talking with current students and finding out what their interests were and what their classes was just a really good process for me to kind of narrow down. So I would recommend doing that. And if you can't do that, looking at their general coursework. And at first that might seem a little bit boring, but if you can get a quick a quick description, it can help you imagine yourself, if you're in that class, would you be enjoying what you're learning? And then all of the other things that people mentioned, like the location and the potential connections and job opportunities after, are really key. And then the other two things was just thinking about who I really wanted to respect the people and trust as much as you can trust a professor that you don't really know that well, but to me, like being taught by people that I looked up to was really important. So looking at the different professors and if possible trying to get a meeting with them or having a call or exchanging an email was really helpful to find out, okay, so, you know, this person could be like my mentor, or I could, you know, this person is, you know, shaping the way that the degree looks, and I appreciate this person's perspective, because I realize like it's expensive and it's your education, and it really is good to think about like who's shaping that program and being connected with them to make sure that it like serves you best. And then the last part was just thinking about the school in general and the school's reputation and mission. So not just reputation of like being an like upstanding like leading school in public health and in the field, but also like, well, what are your personal values, and how do you see that come through in what the school talks about as their mission and their values?
Thank you, Victoria. Our next question is, what's the hardest part about the application process, and how did you handle the pressure?
I think just sitting down and actually doing it is the hardest part. Just getting started. I mean, you know, once you get started and start going through the edits, it's a little less painful, but actually sitting down and starting it, I think, is the hardest part. But I will say, as far as the application process goes, you know, grades are important, GREs are important, all of that stuff that you always hear. But really, if you have the opportunity to go to the school and meet with some people you're interested in working with, some of the professors there, face-to-face meetings, I think, are really invaluable. I think that can really, I wouldn't say seal the deal for you getting in, but I think that making that connection is huge in the process, as opposed to just being some other, you know, sheet of paper with numbers on it. So I really think if you're interested in some program, if you live close by or have the opportunity, go meet with the professors, see what they're researching. Maybe you're interested in doing some of the research they're interested in, and kind of try to connect on that level, because I think that is just indispensable in this process.
Yeah, and I'll also add, yeah, like just getting started, that's a big hump to get over, and then. In terms of like, writing your personal statements and the contents of, why do you want to go to graduate school? Why do you want to pursue this public health degree? The more you sort that out, the more you find out what you're really interested in. And you may not need to, hone in on that one thing, but at least in general, what do you want to accomplish from it? That goes a long ways to helping you write your personal statement, and having a clear idea that you can articulate to the admissions committee, and just kind of, if they see that drive and that passion in you, I think that definitely gives you a better chance, and it helps. It does help the application process go easier too, because you kind of know what you want, and you can just focus on that rather than get really stuck on the minute, details of like check boxes and stuff like that. So granted, there are still, all those things you gotta make sure you turn in on time, got, your letters of reg, your e-scores, and whatever else is required.
What was the question again?
What's the hardest part about the application process, and how did you handle the pressure?
I think just to add on to all of that, or for me at least, one of the hardest part was the GREs, because I always freak out about standardized exams. I don't like them, and I'm always nervous. So what helped me is that I just try to give myself a lot of time to study for it, and make all these flashcards and everything, do a lot of practice tests. 2 months before something. So that really helped me just get used to how am I gonna act when I enter in the exam. And so just so that you don't freak out in the end and everything, just give yourself time to study for it, and it shouldn't be that hard. And as Addison said, it's not the only thing that matters, the GRE. So even if you don't get the top score that the school requires, they would still look at other things.
Another thing I'll add is I think I had kind of a unique experience applying because I applied right out of college. I didn't work for a few years, and so when it came to the letters of recommendation, the letters I had to get were the ones from my professors. And like, I didn't go to college here, but it was a very large campus and it was very large classes, so it was very hard to get to know professors at a level where they could write you a good letter of recommendation. So my recommendation to you guys would be to go talk to your professor to have them get to know you as a person and let it show that you're passionate about public health, and that will come across the letters of recommendation from the professors.
Thank you, Cathina. Okay. The next question is, are you planning to pursue additional degrees after MPH, and how will the MPH help you with this plan?
It's because I'm doing a dual degree right now, so I applied just for the public health degree, and so if you are thinking about additional degrees, either like during, for example, I would definitely look at the schools because they all have different rules. Like, for example, I think Columbia requires if you wanted to do a city planning and public health degree that you have to apply to both of them and get into both of them. So if you're considering doing multiple at the same time, just figure out what the school requires. But Berkeley allows you to apply and add another degree on if you are admitted. So that's what I did. And my thought process, I kind of was leaning towards that. As I was realizing I was really interested in social determinants of health, which is thinking about those more upstream factors that shape your health outcomes, like education attainment, income, like access to food, whether or not you've been incarcerated, things like that. And I felt like the way cities are shaped and built and structured really impacted basically what a lot of people say are choices, healthy choices or healthy behaviors. So I felt like adding the city planning would really help me think about, well, why does this neighborhood in San Francisco, they're like doing a lot of redevelopment, or they just built like a new transportation system, or like a new train to go down this road. And so why is that happening, and how is that impacting people's ability to maybe get groceries or go to work, or just in general like live life and get out of get access to the different social services that they need. So I started realizing that for me, social determinants of health was really shaped and impacted beyond just like sort of behavioral interventions. And that's why I wanted to add on the city planning degree. And I think just having those two, and I also think, a theme that has come out is that public health can be a lot of things and that it is interdisciplinary, and adding the city planning, I think really is complementing my master's in public health degree, because it's helping me hone in on a like master's level understanding of another field. And I think in the future, the reason why I would like to do it like this dual degree is it'll help me learn the language of different sectors, because I want to affect change in multiple fields, because I think that's how we get to healthier outcomes for communities and populations. So by learning what does zoning mean, and what is a conditional use request, what does that mean in sort of city planning terms? By understanding that, I can better map on how that relates to health. Therefore, I can better communicate with different leaders in different fields and try to create policies that are more holistic in understanding how health impacts everything, really. So that's why I added the dual degree.
Thank you, Victoria. Does anyone else want to answer this question?
So I am not currently thinking about getting any further degrees, though possibly a few years in the future, I would consider going for a PhD in epi. But really, I didn't have public health experience before this, and so I really want to get out into the world and apply what I've already learned before I make that commitment. I have a few friends who are going to be doing the PhD in epi right afterward. And the reason to do that would be if you wanted to be a principal investigator on a study, which is really great. It's also a lot of responsibility. So making that decision and what you feel you want your path to be. People who don't go for their PhD, they all find work still. A lot of work in health departments or in research groups. So it really depends on what you want out of it in the end.
And I kind of did the reverse. I got my master's in nutritional biology first before I got my MPH. I found the MPH later. I love it. I really am more interested in doing kind of public health. Currently, I'm working towards getting my registered dietitian's license. So if you're interested in nutrition, I know working at state, a lot of times you'll see if you're in, a nutrition branch, a lot of them have their MPH as well as their RD or one or the other. So I think it complements well kind of the area that I'm interested in going into, and it possibly affords me more opportunities in that field. So that's why I did that. And I also wanted to mention what Victoria had said. Look at the schools you're going to apply to. If you really do think you're going to be getting a second degree, see kind of what the rules are, because I had the nutritional biology and I kind of had an overlap time. So I had some classes that I could apply to the MPH. So if you're going to stay at the same institution, it's good to know how many units you could transfer possibly to a second master's. It's also important to know can you be dually enrolled? At UC Davis, you cannot be dually enrolled in a master's program, so it can be different for different schools. But if you're going to be doing both of these, degrees at the same institution, seeing kind of what the finer details look like is important, as well as for me doing the coursework to be able to apply to a dietetic internship. I took those classes while I was getting my master's, so it wasn't additional money I had to pay. Also, I would recommend for any graduate school you're going into, look at funding opportunities. You can get GSR positions, which are graduate student research positions. You can also be a reader or a grader for different classes, or a TA, a teaching assistant. So I was a teaching assistant for an introductory biology class, and it paid for my schooling, and it gave me a stipend every month so I could pay for housing and food. So I highly recommend try not to pay for it yourself. Really look and seek out those opportunities to be a teaching assistant, or if they have research positions open, that's great too. But if for your undergraduate degree, if you're getting it in biology, seek out the biology department or the microbiology department at the schools you're interested in, and see what are opportunities to become a teaching assistant. Or if you are really interested in philosophy and you've taken lots of philosophy classes, you could be a TA for a philosophy class. I know, Cathina, were you a TA for?
That wasn't me, that was Nicole.
Nicole.
Yeah.
So we had another student in our cohort who was a TA for a psychology class, right? So there are opportunities out there, because it is a big chunk of change. So if you can get someone else to pay for it, all the better.
Thank you, Addison. So for our final question, we have, what advice would you give students who are interested in pursuing an MPH?
Go ahead.
Okay. I would just say to start exploring your interests right now. So if you don't already have experience in your field, try to find any sort of way you can get that experience. So if you're still a student, talk to professors. If they're doing research, see if you can, even if it's just volunteer and you're not getting paid, do whatever you can to sort of sink your teeth into those interests now, and it'll really help inform what you decide to pursue, and also make you a lot more competitive when you are applying for an MPH.
I was just going to say, along those same lines, I agree with everything Adam said. Also, to look at all the different programs. I made so many Excel sheets about all the different application requirements, and then what do they prefer out of applicants, which schools can I get in touch with, or could I get in touch with and not, and just see how you feel. I mean, I remember there was one school I was emailing back and forth with, and all the vibes I got from the email was just very cold, and I didn't feel like they particularly wanted me to go there. And so, and it isn't where I ended up going, obviously. So just start making those relationships with the school, start trying to talk to students and see what kind of vibes you get, even if you're a year or two out. And then again, I can't stress the importance of getting relevant experience, because the worst thing that could happen is you could go put down a big check for a school and then realize a semester in or even a few weeks in that this isn't a good fit for you.
Thank you, Lila. Does anyone else have advice for students?
I guess just to add on would just be like, make sure you're really like, passionate about it and you're not just going for the sake of going, because I mean, it's a lot of work and like, I mean, it's 2 years, but like, it's, a lot of money for that too. So just make sure you know like what you're getting into and like, you really want to do that and you're not just going, so.
Yeah, like building on, I think what everyone has said so far is, for me, it was like a paradigm shift a little bit. When I went to undergrad, I was just kind of like really excited to be like getting into college and going into college, and like I would recommend working. I think that really gave me a lot more context to understand my classes, and I think I'm getting more from my classes because I did work beforehand. But that time frame kind of helped me to realize that like it's my education, and I really need to know as best as I can what I'm going to get out of it, and really make sure it is for me and it isn't for the letters. And even if it is for the letters behind your name, like I think that will shine through in your application as well, and they might see through that. So just really kind of doing that shift of like, I'm paying for this, it's expensive. This school that I want to go to really needs to like serve my needs as best as it can. And so thinking about that as you sort of figure out what school you want to go to. Instead of just being completely nervous about, will they take me? Will they pick me? Thinking about, well, do I want to pick them? I don't know. So that would be my other advice.
I'll add one more thing. And thank you, Victoria, and everybody else. So I think the common theme, or one of them, is just like take initiative. Like just go out there, reach out to the schools you're interested in. If there are faculty members that you like their research or the area that they're practicing in, just reach out and send an email, or don't wait around for something to happen to you. This is your life, your education. And so, take initiative in terms of, gaining experience, like Victoria mentioned, like working some that can help you to realize, okay, is this what I really want to do? If it is within the realm of public health, it may, strengthen your interests, or maybe it may show, this particular area isn't what I'm interested in. And that's just as valuable, finding out what you don't want to do. And that also has, implications for whether or not you want to go on for further education. So looking at a PhD or not, just asking yourself, like, what is it that I hope to achieve? What do I need to get there? And then go for it, like take the initiative. You're your best advocate and champion, so.
Thank you, Dan. And
oh wait, can I just say one more thing? Sorry.
Okay, yeah.
So if you can't, we were tabling earlier today, and the questions came up. Well, what if I can't get like the relevant experience that the school that I'm applying to is looking for? And so if you feel like that's not happening, one, like be creative. Try to find something that you can think relates as much as possible, and then in your application, really be creative and discuss those components that do overlap and talk about how it is related. And then two, like volunteer. So once you're out of school, you will have like contained hours at which you work, which is actually really nice now that I'm back in school, and I'm like, oh. So when you have those contained hours, it allows you to like pursue you realize you actually have more time probably than when you were in school. So then volunteer. So give your free time so that you're actually demonstrating. It's one, initiative, like Dan was saying, and two, it's giving yourself that experience to see, is this something that I'm interested in? So just be really creative about how you learn more about the field. So there's a lot of inroads to do that. If it's not a job specifically categorized in health and social behavior, there are a lot of other creative ways to get that experience.
Thank you, Victoria. So that concludes our student panel. I would like to thank our distinguished speakers for coming here to speak today. And we have a few minutes, so you can come to the front and ask any personal questions. Thank you.